This broadcast of Pennsylvania Newsmakers is presented by PAConstructionjobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionjobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hey, welcome back. We're talking about the implications for the National Health Care Bill, how it affects you. The host asked a complicated question to the guest just as we were going to break. All right, doctor, look, this has to put huge pressure on nursing homes, less money, Medicare, you know, if the $500 million or billion is not put back in, this is a huge consideration. Talk about that.
It's a huge consideration for the elderly, who, when they get sick as they get older and need chronic care, often people haven't planned for what they're going to do because Social Security won't pay for it.
Right.
Medicare only pays for acute
like 90
rehab,
days,
90 days.
90 days, yeah.
And most people don't have long-term care insurance, so
Right.
they ought to begin to think about that when they're in their 30s or 40s or 50s, not when they're 70 or 80. The health care reform bill included a little tiny piece of long-term care, but not much, and it's a voluntary program. So what this does in Pennsylvania and in other states is it forces the Medicaid program to cover the care of the poor elderly. And that number is those numbers are going up rapidly in Pennsylvania, and they're going up even more rapidly now given the recession we have.
Yeah.
And they're going up not only because people are poor, but those who had enough money are spending down much quicker, and therefore it's really squeezing the nursing home.
Now there's another aspect of this, and that is that it's a joint, Medicaid is a joint program funded by the feds and the state government, and with states hard-pressed for budgets, that means that state budgets will be affected by Medicaid as well, yes or no?
Yes, and fortunately, and I think it's going to happen, the federal government, the Congress will extend what's called the enhanced federal match through the end of 2011, or fiscal year 2011, which ends next June 30, a year from now.
Right.
The problem is going to be what's going to happen in the future. And when you look at the Pennsylvania budget today, it's $29 billion. And about 10% of that is federal stimulus dollars. And when you add then the growing elderly that's happening in this state and the removal of the enhanced FMAP, we're going to have a real budget crisis. And if you try to then compound it by decreasing Medicare funds, what's going to happen to these elderly who need the services is going to be a real problem.
So in other words, you're in this sort of catch-22 situation. But in addition to that, on the state budget, when the Governor Rendell recommended his budget this year, which passed the House, I think, on March 22nd, it's now over in the Senate. This is a new $20 billion increase over last year. He's counting on $850 million on the Medicaid side to balance it.
And he's going to get that money from the federal government.
And you're confident?
I'm not. I'm more than just hopeful. I think he was quite right to predict those dollars would come forward. If we didn't, we would have a real crisis. The problem is going to be that that's just holding the safety net together for the elderly. When that money's removed, we're going to have some real problems. And while people want us, when they're getting sicker and older, they want to stay in their homes as long as they can, and that's fabulous, and that's what I'd want, and that's certainly what you'd want. But the question is, when they need nursing home care, it ought to be provided in a way that the state pays adequately for the services that are provided. So we don't have what happened in Massachusetts with the hospitals when they were inadequately paid, even though more people were covered.
In a minute or so that we have, are you concerned that, that one of the criticisms of the health care bill was that people said, well, you're going to have big government looking over looking behind the insurance companies saying, pay for this, don't pay for that. You can only get this kind of treatment. You can't get that kind of treatment. Now, as a doctor, does that raise some concern with you, or in your facilities, that big government will be telling your folks what they can do and what they can't do?
I don't think there's any real evidence that that's in the bill. I think that was a lot of scare tactics. But I do think that there has to be some rational decision-making, that a doctor can't just order, or a hospital or a nursing home, whatever, anything that they want.
8,000 tests, I'm exaggerating.
I mean, but that's why you need some real tort reform. But I don't think that there's the
so
quote,
doctors don't play defensive medicine,
right.
That's your point.
But the death panels and all that stuff, that was all rhetorical nonsense, quite frankly, because that is not in the bill.
Yep. Okay. Well, look, I want to thank you. Great update. All right, when we come back, it's Financial Education Month.